Nico, can you hear me?
You're loud and clear. Thank you.
Thank you.
Oh, really? Yeah. When was that? When you hopped over here? Why? What's the point in that?
Yeah.
It's your myself.
That was my old company. The golden latte sounds pretty good.
Golden latte?
Yeah, it has ginger in it.
Oh. I love ginger. No one's called in yet.
No. Unless it's a drink.
Whoop.
morning, Nico. Can you hear me?
Loud and clear, thank you.
Thank you, Nico.
That is so much cool. So much better. I didn't realize that there was an unmute button here. So last meeting, I was accidentally unmuting myself because I was adjusting. And they're like, where's the echo coming from? Oh, fuck.
It is coming from the Board of Supervisors room this time.
Oh, it's that little red button.
Yeah.
Ah, I gotcha, okay.
Yeah, but I was just adjusting it.
Uh-huh.
And I was like, oh,
Tapping it by accident.
yeah, I didn't realize it.
Well, cool, thank you for the run through there, and then,
Yeah, it's not much. It's
Yeah.
just basically, as long as you have a picture of how it's set up.
and this USB cable here goes to the camera, but there's also a video cable that comes from the camera, right? Or is it only the USB?
It's only the USB.
Only the USB,
So
okay.
basically, the camera has a power.
Oh, that gets, yes, okay, that's what the two
And
cables
the
are.
camera has a,
Yeah.
rather than the camera has a USB.
Does it take any drivers to install or anything like that, or?
Okay. Really, thing is to make sure that it's pointed in the right direction.
Yeah.
Yeah, I'll do that.
Just have it
I'll
be on
probably
us.
set it to do, if they're sitting apart, I'll probably set it to them, you know?
Right. Because that's just controlled via the remote. You push one button and it switches over and then, yeah.
So basically, if you're staring at your face up there, something wrong. So basically,
Because it should never be this camera, it should be that one. Okay.
so that goes to here,
Mhm.
that goes to here.
Gotcha.
And as long as you have a network connection to the phone, to
Mhm.
that machine. I do this meeting through Wi-Fi, which sometimes makes my
Slower, right?
It makes it slow just a little bit, but the audio looks clear. That's why I'm always listening to the audio, to make sure that that's coming through. There was one time where the call did not disconnect, it was just about so he was still connected to the machine or connected to the meeting, but it must be able to lead it through. People were like, wait. Oh, no, actually, that one actually did drop the call.
It did drop, yeah.
But yeah, after that, I started listening to the meeting just to make sure that everything was fine, because I wasn't listening to the meeting, I was just checking out.
Right. Well, and I guess the reason why you have to do it via Wi-Fi is because you don't have a network port.
I tried through download, and
Yeah, like worse than on Wi-Fi.
yeah, like I really didn't like it. I don't know if it's this room. I mean, I'm fine. I could probably bring a talk. But that's a lot of it.
Yeah. Well, I was gonna say if it's the main laptop there that you want to have operational is connected through the phone, but then yours you could run off of one of those other ports and that would still be fine, right? Okay.
So this one, the only thing is, another note is the day before on the test, you always want to make sure that you check Bell commands, and also software center. We should not get any surprises today. And that's the question to answer.
Yeah.
Which is about it.
And I'll make sure to check that tomorrow too, when I'm over here with it. And you have this laptop up in your queue?
Hi, Nico. It's Adelinda. Can you hear me?
You are loud and clear, thank you.
Can you unlock my account? Because I'm on my phone. It's
Yeah.
my, thank you.
They talked about the regional transportation authority, last week.
Client services,
They're gonna have to,
Hey, Nico, this is Supervisor Christie. Can you hear me?
We can hear you loud and clear, Supervisor.
Thank you very much.
Yeah, I saw you like, I could tell that the gears were turning. You're like,
the meeting to order. Roll call, please.
Supervisor Christie.
Here?
Supervisor Grijalva.
Here?
Supervisor Hines.
Here.
Supervisor Scott.
Here.
Chair Johnson.
Here.
Let the record show all members are present. This meeting is being conducted virtually.
Now, please rise for the Pledge of Allegiance to be offered today by Supervisor Christie.
Join me in the pledge to our flag. I pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, indivisible, under God, with liberty and justice for all.
Thank you, Supervisor Christie. And now, Madam Clerk, is there a problem with pause for pause? Something about it rebooting?
Chair Bronson, the AV system is rebooting, and so IT cannot show the video until it is completed.
Okay, so we will delay that item until we have word that it is available for viewing. And now I'd like to, we have a number of changes to the agenda, amendments to the agenda. On agenda item number 4, that item is being continued until the meeting of March 15th. On agenda item number 5, proclamation for Los Cienegos National Conservation Area. The county administration has requested this item be removed from the agenda. On addendum item number 7, correction to the February County Fair horse racing dates. Revised dates are February 26th and 27th. And I think that is the end of any changes to our agenda. If there are no objections, the agenda will be so amended. Okay, and now we have, let's see, we have one presentation, and I think that is on the addendum agenda item number 1, presentation of a proclamation to Charles Mccollum, Tucson Unified Career and Technical Education Coordinator, proclaiming the month of February 2022 to be Career and Technical Education Month. I'll move the item.
Second.
Motion and a second. There are no objections. Supervisor Grijalva will make the presentation proclamation. Supervisor?
Thank you. Let me go ahead and read this. Whereas February 2022 has been designated Career and Technical Education Month by the Association for Career and Technical Education, and whereas Career and Technical Education offers students the opportunity to gain academic, technical, and employability skills necessary for true career readiness, and whereas students in career and technical education programs participate in authentic, instructive experiences that improve the quality of their education, and whereas career and technical education provides students with career exploration opportunities earlier in their educational experience, allowing them to make informed decisions about their professional goals, and whereas leaders from business and industry nationwide report increasing challenges related to addressing the skills gap and to connecting qualified professionals with available careers in critical and growing fields, including healthcare, energy, advanced manufacturing, cybersecurity, and information technology, all which are important industries in Pima County. And whereas career technical education prepares students for these and other fulfilling careers by offering integrated programs of study that link secondary and post-secondary education and leads to attainment of industry-recognized credentials, whereas career and technical education programs ensure that employers have access to qualified, experienced workforce, ensuring America has a strong competitive economy, and whereas young people are the future of Pima County, and in this country, we want to make sure that they have all the tools they need to succeed and thrive in our ever-changing world and contribute meaningfully to our community. Now, therefore, be it resolved that the Pima County Board of Supervisors hereby proclaims the month of February 2022 to be Career and Technical Education Month, passed and adopted this first day of February 2022.
Thank you, Supervisor. Is anybody in attendance on the phone that would like to make any comments? Madam Clerk?
Madam Chair, or Chair Brunson, I'm sorry. Charles McCollum is on the line. Mr. McCollum, would you like to make comments? I see that he is muted.
Am I muted?
Oh, he's
There
there.
you are, Chuck.
Am I there?
You're there, Chuck.
Okay, great. Again, on behalf of all school districts in Pima County, I'd like to thank you for approving this proclamation. Career technical education, as you know, is a very important aspect in our students' education, preparing them for the workforce and for post-secondary careers, no matter what they are. And for us to not look at this in a very strong and impassioned way is really something that would be remiss for our kids. So again, thank you very much, and this is great. Thank you.
Chair Bronson, can I just
Yes, go ahead.
Yeah. So thank you, Chuck, and Pamela Shapiro from TUSD Career and Technical Education, although this is something for every district, for bringing this proclamation to our office. You know, I know that your teachers and staff have been especially hit hard this last month, and I just want to thank you all publicly for all of the work that you're doing to ensure that our young people are continuing to be able to on this career path that they've chosen. So I understand the importance of making sure that the young in our community have access to all of these resources, and thank you all for making sure that they continue to have that access and opportunity.
Thank you, and hey, it's all about kids. So we got to do what we got to do right now. So we're going to do the best we can, and we're going to get through this.
Thank you.
Yes, thank you for those comments. I'm going to go back to the clerk. Are we ready for pause yet, or shall we move to call to the public?
Chair Brunson, the reboot is completed. We can move on to the pause.
And let's move on to pause for pause.
Hi, everybody. My name's Monica Dangler. I am the director here at Pima Animal Care Center, and I'm here today at Pause for Pause to introduce you to my friend, Seamus. He's all ready for Valentine's Day. Seamus is 10 years old. He's been with us for a few months. He came to us as an owner surrender. His owner could no longer take care of him. As you can see, he's a little skinny. He does have a thyroid issue that is easily treated with some medications. But he's a good boy. Like I said, he loves his outfit. But Seamus is just one of the many dogs we have here available for adoption, including our cats. We currently have about 380 dogs on site, plus another 600 dogs in foster care that are available for adoption. We have about 90 cats here available for adoption on site, and then another 600 in foster. So we've got just a few dogs and cats ready for you to go home with you. Right now, the pet, shelter is pretty full. We had a large adoption event, which was great, and sent lots of animals to foster. However, we're experiencing COVID like everybody else, and we're starting to have some staff shortages. So the more animals we can get out of here, the best. We no longer have any dogs or cats in non-public kennels, but we can definitely use some additional help getting those pets out of here. We're still really, really full for this time of year. All of our adoptions to help you take a pet home, our adoption fees are waived except for a $20 licensing for dogs that are over the age of 4 months. If you'd rather foster, we would love you to foster. Even a 2-week foster is super helpful for us, just to help get some notes on those animals and help alleviate some of the kennel crowding. all fosters. We can give you food, crates, all the things you need to take a pet home. And we've got just about everything for everybody. We've got dogs like Seamus here that are pretty easygoing, real nice pups. We got some young pups. We've got puppies. We've got kittens. We've got all the things. So if you're looking for a new best friend, please come down to pack and foster or adopt. Thanks, you guys. Hope to see you soon.
Thank you. All right, then let's move on to call to the public. We have 5 speakers. I want to remind each speaker you have 3 minutes. Please abide by the rules of civility. And our first speaker is Judy Rich, who is CEO of Tucson Medical Center. Is Ms. Rich with us?
I am. Good morning. Thank you for this opportunity. As we enter year 3 of COVID-19, we are all pretty tired. I imagine there have been few Board of Supervisors agendas that have not included a discussion about COVID. When I speak to my colleagues from across the state and the country, I appreciate even more how important the strong partnership between the Pima County Health Department and hospitals like TMC has been throughout the pandemic. From vaccinations to testing to coordinating emergency response from a county-wide perspective, we have all benefited from the county's tireless work, so thank you. As a large urban hospital, Tucson Medical Center cares for patients from Pima County and beyond. This is how our hospital safety network functions. Hospitals like TMC support intensive care units, maintain comprehensive on-call specialty coverage of physicians, 24 surgical coverage in the operating room, and more. Our small rural hospitals do not have volumes to support that level of acute care services, and as such, their role is to stabilize the patient and coordinate the transfer to a higher level of care. Prior to the pandemic, the vast majority of transfers to TMC originated in Pima, Cochise, Graham, and Santa Cruz counties. But in our current environment, transfers come in from throughout our state and others. For COVID patients, those transfers are coordinated primarily by the Arizona surge line that Governor Ducey implemented to ensure COVID patients were distributed to the hospital most rapidly able to accept that patient. The goal was to level load throughout the state as different regions experience surges at different times. For a hospital like TMC to limit our service area to Pima County will be in violation of federal law and would leave vast portions of our state without access to critical acute care services. Non-urban counties simply do not have the patient volume to build staff and support the critical care and surgical services needed. Centralizing high acuity services is cost effective and it reduces costly duplication of services. In closing, TMC has long partnerships with rural hospitals to ensure that those residents have access to the care they need and when they need it. This pandemic has certainly strained our capacity at times to the limits, but we remain committed to our regional partners and are working hard every day to meet the critical needs of all the people we are here to serve. Thank you.
Thank you, and thank you for that informative, well, it's not a discussion because we can't discuss a call to the public, but appreciate getting that information. It's useful. And again, thanks so much for joining us. We now move on to our next presenter from Call to the Public, Stephanie Kirk.
Yes, thank you. Good morning. Can you hear?
Yes.
I would like to first thank Steve Christie for his continuous fight toward body sovereignty. I would also just like to thank him for showing up and representing the people through this pandemic. I would also like to point out a piece of a statute. Under 21 Federal Code of Regulations 5023 and 5024, I wanted to let you all know, including Matt Hines, that it is illegal to participate in an experimental program using coercion. Our Board of Supervisors in Arizona, Matt Hines, recently suggested in a meeting that those not jabbed should be charged with murder and not be able to participate in normal everyday activities such as shopping, travel, and attend college. Shortly after, he gathered with his friends on New Year's at a Mexican restaurant, and he posted proof on his Instagram account. What a slap in the face, Matt, this is for the call to the public to be on Zoom and the Board of Supervisor meeting to be on hold for basically 2 years. If Matt can attend a restaurant for New Year's in a mask, he can certainly attend a board meeting, unless he is afraid to be held accountable by the public, as we all call him out for his tyrannical behaviors. I like how he can't even pay attention. He's always doing something else as well. So with that being said, if he can personally mask and receive all his bajillion boosters, which are said to not stop or prevent the transmission, as well as those that are infected with the COVID, those that are being given the COVID jabs, have the same level of transmission virus in their nose as anyone else walking on the street that is supposedly asymptomatic. No, instead, he wants to use blackmail to get back at others to take place in an experimental program where the court said, no, you can't take 75 years to gather the data. You must do it in a year. Instead, he's looking at everybody in the public, blackmailing them along with most of the people sitting there right now listening besides Steve Christie, breaking the law. Recently, Matt Hines signed up to speak at a conference outside of St. Joe's due to a lack of staff from unconstitutional mandates, but he dodged his call to duty when he realized.
Ma'am, Ms. Kirk, your 3 minutes are about up. Please wrap up.
Support the mask or the vaccines. You don't give enough time to speak at all. And you guys need to start doing these Zoom meetings in person. It is ridiculous that you all are out masking our children for money. The ARPS for 3 5.
Your time is up. We're going to move on to the next speaker, Gail Stern.
Madam Chair, we were unable to reach Ms. Stern.
All right, and then our next speaker, Felipe Garcia. Is Mr. Garcia with us?
Madam Chair Bronson and members of the Supervisors, good morning. My name is I'm Felipe Garcia. I'm the President and CEO of Visit Tucson, and I'm here just to talk about the amendments to the development agreement between Pima County and the owners of the Omni Tucson National Resort that will be on the agenda today. But first I want to start by actually thanking the staff of Pima County for getting together with the owners, having a conversation, trying to find a positive solution for this new project that the Omni will undertake in the next couple of years. So we know that tourism, we've been facing many challenges in the last few months, and all of the industries in our community, in our state, in our country, and the world. We know that we're not out yet of the pandemic. Omicron variant has had a strong impact in travel, specifically in meetings and conventions. But again, hearing Judy Rich speak a few minutes ago, for us it's very important to bring back tourism, but bring back tourism in a safe manner for our residents, our visitors as well. Now, this agreement, we know that will help Omni Tucson National keep moving forward, bringing back tourism to our community, something that we need for its economic impact and for many other reasons. Not only investing in this facility that employs right now hundreds of residents of Pima County, the agreement will benefit our communities through the work that the Tucson Conquistadors are doing every year through the golf tournament that PGA will be hosting here in a few weeks, and again will continue to be here in town. So I just want to appreciate the partnership between Pima County and Visit Tucson. Thank you for considering this item, and we look forward to keep rebuilding a strong and safe community for residents and visitors as well.
Thank you so much for those comments, Mr. Garcia. And yes, bringing back tourism is going to be a challenge. But the gem show is back. Hope everybody is masking, staying safe, practicing distancing, and also making sure that they are washing their hands. And with that, let's go to the next speaker, Shirley Rickwag.
Yes, and thank you. I'd just like to let my listening audience know that I am a retired OM, and I've been studying what's been going on in this country for, in fact, in the world for the last 20 years. There's an ever-present horror with which we've been living of late, known as vaccine mandates, which is a direct result of bribery, coercion, and even blackmail by a large group of uber-rich elitists who are dead set on, quote-unquote, controlling the population for their own enrichment. Our hospital systems have been corrupted in their plot of bribery and coercion by succumbing to the allure of upfront payoffs for listing patients as, quote-unquote, dying of instead of, quote-unquote, dying with. A misnomer referred to as the term novel coronavirus. And it's not only the hospitals. Persons in office, those who hold board and council positions, city and county personnel also have fallen victim to these nefarious schemes, eagerly accepting the monies that will allegedly be used for things like roadways and schools, purportedly, but which actually ultimately land in their own pocketbooks. Mask mandates, social distancing, and lockdowns, all for the sake of the almighty dollar. And I would put an exclamation point after that. If this were not so, why would big box stores and large hardware facilities be considered essential when mom and pop stores who base their sole livelihood on the sale of exactly those same products are made to close? And liquor stores are allowed to be open while exercise studios and gyms must be closed. Schools also have willfully succumbed to the coercion, agreeing to the idiocy of requiring masks on those very persons who are least of all affected by this new virus. Due to these mandates, we are backsliding into a culture of discrimination that hasn't been seen in America in decades. White people now gather arm in arm and hand in hand with Black Americans, Asians, and Native Americans as a group. We're being purposely ostracized and segregated due to our personal choice to refrain from receiving an inadequately tested biological weapon, which is erroneously referred to as a vaccine. The very definition of the term vaccine used to be that one is given said injection in order to prevent a disease. Face it, folks, that just isn't happening. The people who are falling from COVID are vaccinated people. Thanks for your time.
Thank you. And with that, that concludes our call to the public, and we will move on to to the regular agenda, item number 7, Board of Supervisors sitting as other boards. This is the Flood Control District Board. It's a riparian habitat mitigation. I'll move the item.
Second.
Motion and a second. Any discussion? Any objections? Hearing none, motion carries. We move on to item number 8 now, which is the consent calendar. Does anybody wish to divide the question on the consent calendar?
Chair Bronson?
Supervisor Grijalva?
I'll move the consent calendar.
In its entirety?
Its entirety.
Second. Motion and a second. Any discussion? Any objection? Hearing none, motion carries. Moving on to item 9, unfinished business from 1221, 14, and 118, land acknowledgement statement. Supervisor Grijalva.
Thank you, Chair Bronson. So we were able to work with the Bellona Altum Cultural Committee. They approved this proposed statement. So I'll go ahead and read it.
And I don't know if was there a slide presentation.
I was hoping there was, but
Nico,
see it.
One moment.
It's on. Thank you. Supervisor Grijalva, do you want to continue? You're muted.
Okay, I would, yep. On behalf of Pima County residents, we honor the tribal nations who have served as caretakers of this land from time immemorial and respectfully acknowledge the ancestral homelands of the Tohono O'odham Nation and the multimillennial presence of the Pascua Yaqui tribe within Pima County. Consistent with Pima County's commitment to diversity and inclusion, we strive toward building equal partner relationships with Arizona's tribal nations. And that is what was approved by the committee, and that is what I am submitting for this board to approve.
And
I'd like to go ahead.
Specifically, your motion is?
The motion is specifically that this statement be read after the Pledge of Allegiance before every board meeting.
All right, is there a second for that motion?
I'll second it.
There's a motion and a second. Any discussion?
Madam Chair.
Supervisor Scott.
Thank you. I really want to thank and congratulate Supervisor Grijalva for her efforts to craft language that is acceptable to both Pascua Yaqui and Tohono O'odham leaders. Her proposed statement is accurate, respectful, and worthy of approval by our entire community. Its hopeful adoption is also cause for celebration and reflection. This land acknowledgement stems from a candid recognition of the entire scope of our history, which is an important lesson for our children. Its adoption can also encourage all of us to learn more about the histories of our indigenous neighbors. Most significantly, I hope that adoption of this statement will serve as an impetus for strengthening the partnership between Pima County and all local indigenous groups. As supervisors, we need to listen more and learn more about more we can do to work alongside all our friends in the indigenous community. So thank you again, Supervisor.
Any other comments from board members? Then I'll call the question.
Thank you, Madam Chair.
Supervisor Christie, I think.
Thank you, Madam Chair. I have to say that these are beautiful words and beautifully constructed. As a native Tucsonan and a lifelong resident of Pima County, I have deep respect and pride in our heritage and the indigenous communities that inhabit it here. However, I feel that this is this should be in the form of a resolution, and these words should be spread throughout our county on important observations of significant celebration in schools, in gatherings, in historical events, in remembrances of important aspects of our history. But I don't believe that this has any place as a carved in stone reading before the Board of Supervisors. If we're going to address the community and look at it as uplifting the entire residency and community of Pima County, this does not fulfill that job, which I feel is paramount for the Board of Supervisors. To find something that unifies and brings all communities together is I think, a core job, a core mission of Pima County Board of Supervisors. This is not inclusive in that regard. It has a wonderful opportunity to be spread throughout our community, but it does not belong as a mandatory recitation before each board meeting. So I will be voting against this.
Thank you, Supervisor Christie. Any other comments by board members? Then I'll call the question. Roll call.
Okay. This is to approve a proposed statement to be read at each board meeting after the Pledge of Allegiance. Supervisor Christie.
No.
Supervisor Grijalva.
Yes.
Supervisor Hines.
Yes.
Supervisor Scott.
Yes.
Chair Bronson.
Yes. By your vote of 4-1, motion carries. Moving on to item 10. I placed this item on particularly because of the gem show and the possibility of a super spreader. Wanted some information. This is discussion only. There's no action. Dr. Garcia is with us. He had a presentation. I think he has it's another death by PowerPoint, pardon the expression, presentation. Dr. Garcia, if you want to present, but you might, I didn't don't think I saw in the presentation as I was looking at it. Just more information on testing and the precautions we're taking during the GEM show. So, Dr. Garcia, you have the floor.
Certainly. Chair Bronson, members of the board, what we're presenting today is an update on where we are in terms of the pandemic and with some brief commentary on what the activities are that are related to the GEM show. Nico, can we have the first slide, please? Nico.
One moment.
I'll just go ahead, Chair Bronson, and Nico can flash the slides. So at this point, we have had 234,000, so just shy of 250,000 cases in Pima County since the beginning of the pandemic, and fully 24% of them occurred just in the last month. Just in the month of January, 24% of those 234,000 cases. We had a real peak of 17,739 cases occurring during the second week of January this year. That's compared to our prior peak last winter at about 9,000 cases. So bottom line is, as much as we have, we appear to be cresting in terms of the current Omicron surge and appear to be starting to see some evidence that the case numbers are starting to decline. Nico, is that presentation available? Okay. Well, we'll keep going.
Just one moment.
One of the key things for you to and for the board to be aware of is we are in the same boat as 99.75% of all U.S. counties, which according to the CDC's standards and metrics are considered to be at a high level of transmission. It's pretty dramatic, and there was a slide just showing you how dramatic it is to see the entire country in red, except for 3-4 counties across the country. In terms of COVID testing, we have done approximately 2.7 million diagnostic tests since the beginning of the pandemic. Just in January, Nico, do you have anything for me? Well, in the prior week, we had 66. In the prior month, we have had 66,230 tests. One of the things that's alarming is that the positivity rate continues to be very high. It peaked out at about 28% during the third week of January, and it appears to be going slightly lower. I'll remind you that back in July 3rd, when you took the action to lift the state of emergency, our positivity rate was approximately 3%. Currently, as of the first 2 weeks of January, Omicron is the dominant variant. Initially, during the first 2 weeks, it was about 93% of all the variants that were identified in this county were Omicron. Now, as we get to the other side of January, it appears that 98% of the variants that are being identified in Pima County are Omicron variants. In terms of the county-sponsored and county-coordinated testing sites, we are very fortunate in having a lot of things to be able to offer our community. The PCC West Campus is fully operational, doing approximately between 500 and 600 tests per day on a 6-day-a-week operation. They actually have the capacity to more than double that, but this is meeting the current demand, but they are able to provide more testing as needed. In the same way, the Keno Event Center, currently operated by Paradigm, again, continues to be a very productive site with approximately 600 to 700 tests being administered each day. One of the things that's important for you to remember is that this will not include any of the self-administered home antigen tests or self-administered antigen tests that are being distributed either by the health department or by the federal government. Those are not strictly reportable to the state, so therefore they are not included as part of it. Thank you. If you can go to the fourth slide, please. So in terms of hospitalizations, currently we have 470. Last night we had 470 COVID positive inpatients, and the staffed bed availability in the medical surgical unit was approximately 2%. 36% of ICU beds are currently occupied by COVID positive patients. And I don't believe that we have yet seen the full impact of the Omicron surge in terms of hospitalization or mortality. You'll recall that we start seeing that approximately 2 to 3 weeks after the peak because it takes that long for people to become really seriously ill. About 75% of hospitalized COVID cases currently in our hospitals are unvaccinated individuals. And that's an important thing to remember. The latest data from a variety of sources indicates that boosted individuals appear to be particularly well protected against hospitalization and death. The graphs on the side really give you an idea of how our hospital admissions have sort of seesawed. And you'll see that in January of 1st of 2021, we peaked. And again, in January of 2022, are reaching for a peak. In terms of the ICU bed availability, we are a little bit better than we were back in January of last year, but not by much. I'll take the next slide, please. All the data in these reports, by the way, comes from either ADHS or the Centers for Disease Control data trackers so that these can be faithfully reproduced. COVID-19 deaths continue to be something that we are tracking very tightly. And what we've observed is that since the beginning of this pandemic, 3,441 Pima County residents have died as a complication of or have died of or as a complication to a COVID-19 infection. It's too early to be sure, but the current surge appears to be causing less mortality, fewer people dying compared to last winter. This is due to a combination of things, one of which is that there are much more abundantly available therapeutic agents that doctors in the hospital intensive care setting have to be able to pull into the care of those patients. We certainly are in a much better place. The other thing may be that Omicron is causing less severe disease, certainly among the young demographics. Please note that deaths are continuing to occur predominantly in those who are 65 years of age and older, and the second highest group in the 55 to 64-year-old group. It's a very, very rare outcome for infected children to die, although we have had pediatric mortalities. Also, those impacted who are immune compromised and who have underlying medical condition, even though they may not be in those older age groups, are probably at considerably greater risk. Next slide, please. COVID-19 has been particularly tough on the schools this last month and during this school year. 6,633 cases were reported by schools just in the month of January. That's a staggering amount by any judgment. The age distribution continues to be fairly consistent, with most of the children who are infected, 44% of them being less than the age of 11, and about 39% being in the 12 to 19 age group. Again, very stable student to faculty ratio of 85 to 15%. Just under 250,000 tests, just under 250,000 tests have been delivered by the health department to schools for distribution. This represents a giant investment of testing capacity in order to keep schools as safe an environment as they can be. Really, really importantly, just last week and the week before, the federal government took additional action to make direct federal allocations to schools and school districts. In the state of Arizona, the two first beneficiaries will be TUSD and Sunnyside Unified School District. Please also be aware that as of yesterday, when I was texting with these superintendents, those allocations had not yet been received at the school. Additionally, the federal government is putting some pool testing contractors available to schools and school districts with varying levels of success. I got to say that at this point, school districts are expending unprecedented levels of their own and other resources and staffing in response to the pandemic. Next slide, please. In terms of vaccination, we continue to have a very good story to tell with 1.8 million vaccine doses administered in Pima County. 66%, that is 690,000 folks in Pima County are now fully vaccinated. And among the vaccine-eligible population, that is 5 and older, that reaches up to 69.8%. In fact, I bet that by the time that we're done with this meeting, the CDC data tracker will have tripped over to 70% for Pima County. How does that compare with the rest of the state and the rest of the country? We continue to do very well in terms of total population vaccinated and the total vaccine-eligible population. Where I believe we can continue to improve is in the area of booster eligibility and boosting the population. We currently have boosted approximately 43.8% of previously fully vaccinated individuals. That compares with 40% for the state of Arizona and 50.5% for the rest of the country. This is really, really important because we are understanding more and more that how protective boosters are against hospitalization. Finally, I'll just say that the breakthrough from full vaccination is a reality. We've had 34,063 cases of vaccine breakthrough in individuals who are fully vaccinated. That is out of a denominator of over 690,000, so 5.2%. Hospitalizations, extremely rare in that group, 0.11%, and deaths even less so, 0.2%. Just to put it simply, unvaccinated individuals are 2 times more likely to get infected, 19 times more likely to be hospitalized, and 64 times more likely to die. Last one, please, or next one, please. Masks continue to make sense. Any mask is better than no mask. Masks are very effective in terms of reducing COVID-19 transmission when worn consistently and correctly. CDC continues to reiterate this fact. There are some masks that offer higher levels of protection from others, but the most important feature of the mask is the person who's wearing them and the willingness to keep it on. And some folks will respond better to some masks. My 12-year-old does not like surgical masks, will not wear an N95, will always wear a cloth mask, and that's the best that we'll be able to do with him. The board's mask resolution is due to expire on February 28th, and we're in the process of providing an update for you that will allow you to compare where we are at that point to where we have been. Last slide, please. Next one, please. Just to emphasize, these are over 50 publications that attest to the fact that masks have a very important role to play. And you can you go to that website or you can look at these publications individually. Next one, please. Finally, with regards to the Gem and Mineral Show, we continue to do, you can take that down, Nico. With regards to the Gem and Mineral Show, we continue to work with the operators very closely. Dr. Cullen has been working with the operators as well as with the various host sites very closely. We have developed a full set of communications materials, including videos and inserts that really talk about the availability of vaccination, the availability of testing, and the use of masks. Please understand that, especially with our international visitors, they probably don't represent much of a threat because of the way that the federal government has changed the entry requirements. So folks are typically, who are coming in from abroad, are typically coming in both with a negative test as well as being fully vaccinated. With that, I will conclude my remarks.
Thank you, Dr. Garcia. Supervisor Grijalva, and then we're approaching the 15-minute mark, so let's make it.
Okay. I just have a quick question. So I know that we approved that additional site with county funds, and I'm wondering if we can get periodic updates as to the demand. I know the demand is going to be incredibly high now, but as the demand wanes or as these other sites get fully, at their capacity, and when we start to reach perhaps that level that's right below the capacity, that we can start looking at redirecting resources. I just want to make sure, I know that there's the FEMA site, we have other sites that are coming up that are not funded by Pima County. So as soon as we can sort of reallocate those resources, I'd like to. And I just want to thank Pima County for all of the tests that are able to keep our schools open, because without those, really, we're just flying blind. Thank you for acknowledging the hit that our schools took. I do think that based on the conversations that I've had and what we've been hearing from both superintendent in Sunnyside and TUSD, that the numbers are better. But, when you're considering what we were dealing with in the second week of January, better is still not great. So, but, they're doing a really amazing job. All of our sites are, and I know that many of our Pima County departments have also had to deal with a lot of people out with COVID. And so just thank you to everyone who's, able to continue to work and keep everything moving. So, but thank you for all your efforts to try to keep our community safe. It really is very much appreciated.
Madam Chair? Madam Chair?
Supervisor Christie, and then we're coming on the 15-minute mark so quickly.
That's my point. That wasn't a 15-minute discussion as was allotted on the agenda. That was a presentation. The 15 minutes for the discussion should have begun with Supervisor Grijalva starting. So I would hope that we would have some time allotted according to the 15 minutes for discussion as provided, and I would appreciate the time to have.
Again, the discussion, we can't take any action. You can make comments.
All right, and I won't be
with your comments.
I won't be on the clock until I start because of the presentation that took up the 15 minutes. So don't worry, I have brief questions. One in particular, or actually two, is for months, the COVID update discussion was always a matter of standardized placement on the agenda. Two questions. Why was it not on last week's agenda? And
because I took it off.
And secondly, normally the county administrator is the one that places this on the agenda. Why wasn't today's placed on the agenda by the county administrator?
Because I placed it on, and I think as we go through COVID, we get weekly, if not daily, updates regarding COVID. And unless something changes where we have to take action, I don't think rehashing what we already know is a productive use of time. So as board chair, I put it on today. I was concerned about the Gem and Mineral Show, and that there might be something that we needed to make sure the public is aware. But I think we have communication. We're communicating very effectively through our health department with giving the information about COVID. And I will hope that we don't need to place this item on the agenda again unless we have to take action. If that's the case, then that means things have gotten worse. But right now, I think we're on a down. I mean, things aren't great, but they are improving. And I don't see the purpose of us actually saying the same thing over and over again on each COVID update when I don't think it's productive use of time.
So if it's not that much of an emergency anymore, then we can remove the mandates and the face mask requirements if things are improving in such a nature. Is that basically what I'm hearing from you, Madam Chair?
Absolutely not. I think if we want to make sure we get through this pandemic, we still have to do what CDC is recommending. What Dr. Garcia has already indicated. That's to maintain social distancing, to mask, and to test, and to vaccinate.
Then it would be incumbent, I think, that we have this on the agenda from here forward until the mask mandates and any other emergency mandates are removed. And I would implore the chair to see to it that from here forward that there is an agenda item to have COVID updates and discussion. And if I could, I just want to move on real quickly to a letter that was sent to the clerk of the board, and hopefully all of my colleagues have read it, but it it is interesting, and it's from a Pima County employee, and he says he would like to see the issue of charging unvaccinated employees revisited. And I'm assuming he's talking about higher insurance rates for those not working in vulnerable communities that are being charged higher insurance rates because they're unvaccinated. He goes on to say, with cases and hospitalizations supposedly sky high, this can surely no longer be a pandemic of the unvaccinated, given Pima County's high vaccination rate. I would ask the county administration to provide this board with an analysis of what allowing unvaccinated Pima County employees to continue their work versus those that are unvaccinated as far as their health care costs and what it does cost and impact the county health system. And I would appreciate that kind of a breakdown and an analysis, because by what I'm hearing today, there is room for discussion on that issue to be revisited. Thank you, Madam Chair.
Thank you, Supervisor. Any other discussion on this item?
Madam Chair.
Supervisor Scott.
Thank you. Dr. Garcia, there have been a great many media reports of late that indicate that as a nation, we are lagging behind in the vaccination of 5 to 11-year-olds. I wondered if you could provide the board with an update on how we're doing with 5 to 11-year-old vaccinations within Pima County, and if that's something that you prefer to have some time to compile for the board. I don't need an answer today.
Thank you, Supervisor. Any other comments? All right, then let's move on to item 11, and that's the approval of our budget hearing schedule for 2022-23. I'll move the item.
Second.
Motion and a second. Any discussion, any objections? Hearing none. Motion carries. Moving on.
Sorry, Chair Bronson, I was muted. I don't have an objection. I just think that we need to be able to provide more time to each of the departments to be able to share information. Our office is meeting with about 15 departments, just, giving them the time that they need. But I think the process for this budget hearing is, if there aren't any changes proposed, I understand that, but giving these departments an opportunity to talk about what their successes, their challenges are, if there were additional funding opportunities, what they would be able to do with it. The 5 minutes is just really crunched, especially for some of those departments that, like the courts that have many different arms. I mean, I think when we're looking at the hearings, we should really allocate the time to give each of these departments an opportunity. This is really the only time for most of them that they get to get in front of the board every year.
And most of the time, it's what they don't want to do.
Right. And my thing is unless it's going to be meaningful and an opportunity for us to really hear from the departments, then I'm not sure why we go through the motion.
Well, I think most of it has is the fiscal consequences, and you're doing exactly what you should be doing with meeting with these departments individually to get additional information that might be of import as we make policy decisions. So thank you for those comments. Any other comments? All right, then let's move. If there are no objections, we already voted. If there are no objections, then we'll move on to item 12, and this is real surplus property. I'll move the item.
Second.
Motion and a second. Any objections? Hearing none. Motion carries. We now move on to hearings. We have items, these are hearings. We have item 13, which is a fireworks permit. Item 14 is a liquor license, Conterra Farms. Item 15 is a liquor license in Flowing Wells. And then item 16 is permanent extension of premises patio permit for Arizona Pizza Company on Sabino Canyon Road. If there's nobody in the audience that wishes to address us in opposition to these items at this time, move to close the public hearing and approve these items. Is there a
Madam Chair, I'll second, but could I make a comment about item 13?
Sure.
I'm going to go ahead and vote to approve, but based on resident concerns that have been shared with our office and with the clerk's office, I want to direct the clerk and her staff to solicit information from the resort staff about if and how they notify affected neighbors regarding the dates and times of fireworks shows.
Okay. And I think the other piece is we don't necessarily regulate, we're just permitting, and it's the fire departments that provide, and that's a concern I've heard expressed by many residents, you know, what happens if there's a fire. But that, again, fire departments are consulted on. So,
Madam Chair,
Supervisor.
just wanted to mention, as our representative to the County Supervisors Association Legislative Policy Committee, that there is currently legislation being discussed in Phoenix that would give us more authority over fireworks shows other than on the 4th of July.
Good luck. I'm sorry.
At this point, all I'm interested in is hearing what the resort does to notify either neighbors or HOAs.
And I'm not sure that we do anything to notify. But the clerk can determine that, our clerk can, and perhaps that's something Mr. DeBonis could further investigate. All right. If there were no objections, then motion carries. Moving on to the addendum agenda. This is an item that was put on by Supervisor Christie, item number 2, Pima County Health Department role in regional hospitals. Supervisor Christie.
Thank you, Madam Chair. Our office has been contacted by numerous members in the healthcare community, and I'm sure all of you, all of my colleagues and the community as well, is aware of the reports of patient issues at our hospitals. Just as a sampling of some of the comments that this office has received, one worker at Banner suggested that it's gotten so bad with the staffing issues that she thinks patients have to sue the hospitals for failing to provide care and linens, for starters. Another one noticed the situation with ambulances. Ambulances are trying to drop off patients at the emergency room. They've been having wait times of 3 to 14 hours to get a patient off the ambulance and into the hospital bed due to hospital staffing levels. This has created chaos because ambulances can't get back into service to run 911 calls. At the last Board of Reps meeting down in Green Valley, Chief Wonder, who is chief of the Green Valley Fire District, advised all the community that if they think that by calling an ambulance, you're going to circumvent the long waits to be admitted, he said, you're sadly mistaken. He and his department are experiencing hours and hours of wait time. They've gotten so bad that many of the districts, the fire districts, particularly down in Green Valley as well, may consider billing hospitals for wait times to offload patients from ambulances. This practice of keeping a patient in an ambulance takes the ambulance out of service, wasting resources, and the crew may not be able to respond to another call. 2 items that I'll address later are from actual workers at the El Rio Hospital, but I guess I need to address this to Dr. Garcia. Dr. Garcia, do we agree that in area hospitals there are plenty of beds, rooms, and equipment related to hospital care, but not enough staffing to support this infrastructure? And also this includes ICU beds. Is that something we would agree on, Dr. Garcia?
Chair Bronson, Supervisor Christie, the situation that we find ourselves, the situation that our hospital partners find themselves is a situation where they are up against staffing challenges. They are up against shortage of supplies. The therapeutic medication that we've talked about, specifically for folks with COVID, those are the current challenges that are contributing to what we are seeing in terms of the hospital demand. Please remember that this is the season where historically hospitals have been at or near capacity. This is this is the flu season. This is when we see hospital utilization go up. So yes, there are beds, staffing, and supplies and operational issues continue to be something that impacts our hospitals.
We would be in a much better condition, in a much better situation if we had more staffing all the way around, correct?
Chair Bronson, Supervisor Christie, the CEOs of the hospitals will have to talk about the operational details in terms of what would make the greatest impact.
The CEOs of the hospitals.
Yes.
Regarding a couple of workers at the El Rio Health Center that they lost their jobs because they were told that this vaccination mandate was coming out, but they would be able to be considered with religious and medical exemptions. My colleagues and I filled out the exemption applications that the company provided. They were all denied. Another one says all the employees were offered exemption requests. I filed a religious exemption request and it was promptly denied. We were unable to know who was on the deciding committee, and we were not given a reason why, nor were we offered any reasonable accommodations like wearing a mask or being tested. So my question, Dr. Garcia, is given the ability for COVID-infected hospitals, I'm sure you're aware that COVID-infected former hospital workers who have not been allowed to work are now being allowed to come back even though they are infected with COVID. That seems to be a predominant process that we're experiencing right now. So given that reality, would it not be reasonable for those who filed religious exemptions to be allowed to come back to work after they've been terminated?
Chair Bronson, Supervisor Christie, it is not fruitful for me to speculate what an employer would do or not do in that healthcare situation. I will tell you that we have had these challenges with staffing even before there were vaccines. Last January, we were facing the same staffing challenges that we are facing now. So I don't believe that the staffing challenges are due to vaccines, no.
And to follow up, as I said earlier, how would you characterize allowing infected healthcare workers to return to hospital settings? What are your thoughts on that?
Again, it's not, Chair Bronson, Supervisor Christie, it's not useful for me to speculate in the abstract. I will tell you that when the operations of a hospital, and this applies across the board to a lot of different operations that are absolutely necessary, that need to continue to go on, that we have at various times participated in discussions about how we continue to deliver critical services. I believe that hospitals are following the best guidance from the Centers for Disease Control and from their own corporate parent in order to deliver safe care. Individuals who are returning, the few individuals who are returning to hospital and healthcare settings who may be COVID positive are doing so not at random, but are doing so under very close supervision and monitoring, and with a lot of restrictions placed on them. So again, it's not fruitful for me to speculate what CEOs will decide in terms of the operation of their facilities. However, these are critical services, and they are making the best decisions they can based on the best guidance that the CDC has most recently offered.
Well, and then that leads me to this question. In your characterization, in your view, which is worse, that COVID-infected healthcare workers are allowed to return to work in a hospital setting, or is it worse to allow unvaccinated corrections officers to remain on the job? Which is worse?
Chair Bronson, Supervisor Christie, I don't think it's fruitful for me to speculate. These are not comparable situations, and therefore I don't think I can provide useful commentary that will inform your conversation.
Well, maybe you can speculate on this if you would. How do you view the role of the Pima County Health Department? Are you advocating for the hospital administration and its policies, or are you advocating for the best possible hospital care for Pima County residents who are experiencing warehousing and long waits and horrific environments in hallways, not being offloaded from ambulances? Where does the Pima County Health Department come into this mix about advocating for Pima County residents who are going through the healthcare process, in your estimation?
Chair Bronson, Supervisor Christie, first of all, the county health department is not in the position of advocating per se. What we do is we engage with our partners at the local and at the state level and at the federal level to be able to deliver the highest quality of services to ensure that Pima County enjoys a robust and adequate safety net. So yes, we are deeply engaged with hospital administration. We are deeply engaged with the state, and we are constantly having conversations with them about how to optimize these situations. These situations are not of their making. These situations are part of what we are facing with regards to the pandemic. If somebody's really interested in fixing this, they need to get vaccinated. They need to get boosted. They need to do the things that are being required in order to make this a safe community.
But just to reiterate, you view the mission of the Pima County Health Department not to advocate per se for the residents of Pima County that are going through the hospital system.
Chair Bronson, Supervisor Christie, only the Board of Supervisors and the county administrator have the role of advocacy, political advocacy. We work with partners. We work with jurisdictions. We work with regulators to deliver services to create a safe environment. But it is the role of the board and the role of the county administrator to do advocacy at a political level.
And finally, Madam Chair, this is my last point. I've just been in receipt of a letter from the manager of Employee Health and Workers' Compensation at TMC, who states that currently there are approximately 333 employees that have not yet provided employee health with documentation that they have received their second dose of COVID vaccinations. If this is not provided no later than February 21st, those that do not complete this requirement will have their credentials to access TMC systems disabled. They will not be permitted to work until they have completed this requirement and the information has been updated. This is 333 healthcare workers that will lose their jobs if they don't comply with the second dose of COVID inoculation and receive it as such. Is this something that the Pima County Health Department should be advocating for as far as the ability to have adequate healthcare systems that are obviously backlogged and swamped? Dr. Garcia, or is this more of a hospital administration nature?
Chair Bronson, Supervisor Christie, employer mandates, especially in the healthcare setting, have been found to be appropriate and have been upheld by the Supreme Court. These healthcare actors are acting in the best interest of the patients and the community. We will see what that results in.
Even though they can come back to work if they're infected with COVID. Thank you, Madam Chair. That's all I have.
Thank you. Any other board members have comments? All right, then let's move on to item 3, Pima County Library Protocol for Medical Exemptions from Mask Mandate. Supervisor Christie.
Thank you, Madam Chair. Here again, we've received a number of complaints of library employees barring entrance to Pima County libraries to community residents who cite that they have a medical exemption. Here is a very pointed case of a veteran who suffered lung situations from 3 tours of duty in the Mideast. He even has a written exemption by his doctor that he presented to the library workers. He was denied entry, and he was told that regardless of the fact that he has a medical exemption, that he has a doctor's written exemption with him, he will not be allowed access to the library. And that the library's response is that we will accommodate this gentleman. Unfortunately, he had several small children with him. They could be allowed in under certain conditions. He wasn't allowed in to monitor his kids. He couldn't go in with this accommodation because that would mean that he would have to leave his kids outside. It, to me, was a far overreach by the library staff on this issue. And this isn't the only issue that comes up in that same regard about medical exemptions. I'm looking at resolution number 2021-87 that speaks to the face mask covering requirement that this board voted on some time ago. I've gone through it 2 or 3 times, and it doesn't say anywhere that within the resolution that offering an accommodation is the same thing as being allowed access. Either you are allowed access with a medical exemption or you're not. And the resolution says nothing about being barred or being accommodated. If someone provides a medical exemption, they really don't even have to prove it. They should be allowed access to the hospital. That is not happening. And I'm hoping...
To the library.
Pardon me?
You said hospital. You mean library.
Sorry, I got hospitals on the mind. I'm sorry, into the library. I've had a number of constituents say that the library personnel are very aggressive on this matter. They're unyielding. And if you look at the resolution, it says nothing about that the library must be accommodating to these people. It says that they can have access. So I'd like the library departments that are under, I'm not quite sure at this point if I remember with all the changes, who is the administrator that covers the libraries?
Amber Matheson.
She's the chief librarian. Where in the chain of command does the libraries come under? Is it Mr. DeBonis? Is it Mr. Quine? In any event, whoever in the county oversees libraries, I would like to have this clarified with the understanding that this policy needs to stop. If someone has a medical exemption, they should be allowed access into libraries and not be stopped with some sort of accommodation that's not even mentioned in the mask resolution. And I would appreciate that as soon as possible so I can respond to these constituents who do not have access to public libraries. Thank you, Madam Chair.
Thank you, Supervisor.
Chair Brown.
Supervisor Grijalva.
I don't think the library should have to make any accommodations for anyone that is unwilling to wear a mask. It's required to go into every county building. I don't think that they should have to do that. They are being incredibly accommodating by taking services out. A lot of services are online. They'll take books out to your car. I don't think that our Pima County staff need to be at risk for any reason. And if I'm not going to, I just think that we need to do everything that we can to protect our employees. So I don't think anyone that doesn't have a mask should be allowed into the libraries.
Madam Chair.
Supervisor Christie.
I'm reading directly from the mask requirement that this board voted on under Section 2, exempt persons. And it says, persons with a medical condition mental health condition, or disability that prevents safely wearing a mask. These people are exempt. This includes persons with a medical condition for whom wearing a mask could obstruct breathing, as was the case in this one constituent, or who are unconscious, incapacitated, or otherwise unable to remove a mask without assistance. A person is not required to provide documentation demonstrating that the person cannot medically tolerate wearing a face mask. This stipulates that they should have access, free access, with the medical exemption into our public libraries. This constituent even had a written doctor's medical exemption. And clearly in the resolution, it says people with medical exemptions have access to public libraries.
Madam Chair.
Supervisor Scott.
Thank you. I also had a constituent who is a veteran write to our office with a similar concern, and Ms. Mathewson sent him this response, which I will forward to Supervisor Christie because it might be helpful with his situation. She said, "Thank you for your service to our country. I also want to thank you for reaching out regarding your recent interaction at one of our branches. Excellent customer service at all 27 library locations is always our goal at Pima County Public Library. I am sorry to hear that staff were instructive instead of making the request in a professional, respectful manner, and that they did not provide you with alternatives during your visit. As you know, masks are required in all Pima County buildings, including libraries. For those who are not medically able to comply with current mandates, it is incumbent upon us to provide reasonable accommodation. For customers who are unable to wear a face mask, free face shields are provided. For customers who are unable to wear either a face mask or a face shield, we are able to provide service outside of the building via valet print services, Wi-Fi, internet access and printing, curbside pickup of materials, or use of a pickup locker. It is a balance to provide reasonable accommodations while at the same time providing for the health and safety of all who enter our buildings." Then she offers web links for any of the curbside services and finishes by saying, "We are all looking forward to the end of the pandemic when we can once again move about our community without masks and return to face-to-face activities." So as I said, I'll forward this to Supervisor Christie, but it sounds to me, with the direct communication from Ms. Mathewson, that library staff is aware of the accommodations they're supposed to provide and is certainly willing to do so.
Thank you, Supervisor Scott. Any further discussion?
Did we hear from Ms. Lesher? She was muted earlier. It's okay, I hear you.
Am I on now? Okay, thank you. Well, good.
I'm talking, and I'm like, I'd like to hear what she's saying.
That's fine. Chair Bronson, Supervisor Grijalva, I apologize. I thought I'd been communicating, but clearly not. I was simply going to say that, yes, they report ultimately up through me, and I'm happy to provide information regarding what has been occurring to make sure that people can continue to receive all the services at the library, but also adhere to the board's masking policies and keep the other personnel and our staff and the public safe. So let me get back with you on that. Thank you.
Thank you, Ms. Lesher. All right, let's move on to item 4 then. Amendment number 7 to the development agreement with TNR and S Acquisitions, Inc., and resolution number 2022-7. I'll move the item.
Second.
Motion and a second. Discussion.
Madam Chair.
Supervisor Scott.
Madam Chair, I'm going to support the resolution granting the extension, given that its approval will impact an upcoming PGA tournament at the resort. But I would like a detailed staff report to the board on why it is taking so long for the course to begin using reclaimed water, given that the original agreement between the resort and the county was made 17 years ago. And I would like that same report to the board to outline any plans that are or may be undertaken to expedite the transition to the use of reclaimed water for irrigation of the course.
Will do. Thank you.
All right. We had a motion and a second. I don't think there were any objections. So motion carries. Moving on to finance and risk management. Item 5, duplicate warrants. I'll move the item.
Second.
Motion and a second. Any discussion, any objection? Hearing none, motion carries. Item 6 is a revision to personnel. Policy number 8-120, reallocation reclassification. I'll move the item.
Second.
Motion and a second. Discussion? Objection?
Chair Bronson, can we have a summary of what is being changed or revised?
I think it was in the backup material, but
right.
Ms. Lesher?
Certainly. Chair Bronson, Supervisor Grijalva, it's ultimately designed to change the need to have a full compensation or classification evaluation change to a desk audit. Our hope is that we can provide responses to those who are looking for those classifications in a much more timely manner. So that's the full compensation or classification analysis can be considerably time-consuming. We hope now by revising it simply to the desk audit can move forward and allow employees to be appropriately classified much more quickly.
Yeah, I know that this has been an issue in many departments where they're requesting it, and it's a really lengthy process. I'm moving forward. Thank you.
Thank you.
All right. If there's no further discussion, no objections, motion carries. Moving on to item 7, it was amended. The dates should be February 26th and 27th instead of April 2nd and 3rd. I'll move the item.
Second.
Motion and a second. Any discussion? Any objections? Hearing none, motion carries. Moving on to attractions and tourism, items 8 and 9. Item 8 is Metropolitan Tucson Convention and Visitors Bureau doing business as Visit Tucson. For funding for a contract amount of $750,000. And item 9 is Tucson City of Gastronomy to provide for coronavirus local relief aid to tourism. Same funding source. The amount is $250,000.
Madam Chair?
Supervisor Christie.
I'd like to divide 8 and 9 and deal with 9 separately, please.
Okay, I'm going to move item 8 if there's no objection. Do I have a second?
I'll second.
Motion and a second. Any discussion? Any objection? Supervisor Scott.
Madam Chair, according to the budget, over $620,000 of the $750,000 being awarded to Visit Tucson is for social media campaigns. I'm interested in hearing how the success of each one of those social media endeavors will be measured. That question is addressed in Exhibit E, but I would ask that any notable findings be included in the reports to the board that we get from Visit Tucson.
Thank you. That's by way of direction.
Yes, please.
If there are no objections, motion carries. Moving on to item 9, City of Gastronomy. I'll move the item.
Second.
Motion and a second. Supervisor Christie.
Yes, Madam Chair, thank you. I'm very proud of our notoriety as the City of Gastronomy, and it's been a terrific boon to our economy and to our community, and I certainly have always supported it and applauded it. But looking at this particular item, I'm sure I'll probably end up supporting it as well, but I do want to have some things pointed out to the board and also maybe to get some clarity on how this $250,000 funding grant is going to be spent. So to begin with, I've got 3 or 4 questions. The county is providing the City of Tucson a $250,000 grant for this. How much is the City of Tucson contributing to this event?
Supervisor, I guess Ms. Lesher.
Chair Bronson, Supervisor Christie, I do not know what the city's contribution is to this. We're happy to get that information for you.
That would be great. And there'll probably be some other items that would follow with that. I'd appreciate it. And the second question after that one is, doesn't the City of Tucson receive its own COVID relief money where this money is coming from?
Chair Bronson, Supervisor Christie, yes, they do.
So my point is, if they have their own COVID relief money, why are we using county COVID relief money to supplement this event?
Chair Bronson, Supervisor Christie, it was a part of the, I think the City of Tucson's gastronomy is not necessarily related to the municipality of the City of Tucson. It is the City of Gastronomy, recognizing that it happens to be in the City of Tucson. So we work with the City of, with the effort that is known as the City of Gastronomy, and recognizing that it is more a function of a separate economic development and tourism effort that is not necessarily a piece of the government or the municipality of the City of Tucson. But we're happy to provide you with the information regarding the corporate structure and analysis of what's working with gastronomy.
That would be great. So what the intent basically is, this is not just a City of Tucson-centric issue. It's, even though it says City of Tucson, it's designed for more regional advancement.
Chair Bronson, Supervisor Christie, that's correct. And it's been part of Visit Tucson and all of our broader, as you know, regional economic development tourism efforts.
Yeah, I think it's important that it be conveyed in that manner, because it can be confusing as far as who's to benefit out of this versus who's paying for it.
Thank you.
I also noticed in the contract, why is this funding retroactive to January 1st of this year rather than now?
Chair Bronson, Supervisor Christie, we were finally, sometimes as we acknowledge when we have indicated the funding may start, and then it takes a certain amount of time until we get the actual contracts completed and be able to bring them to the board. So it's the time when everybody got things signed and we were able to bring them back, it did not happen for one of the meetings in January, and we are here at this time.
And that would then explain perhaps why the contract is still, even as of this time, while it still is going through legal review. What's taking so long for legal review on this?
Chair Bronson, Supervisor Christie, I don't know what is taking that time, but we're happy to work with Mr. Brown and members of the County Attorney's Office to get you an answer to that.
Would be great. I just saw that in the background, that it's still going through legal review. And finally, if I could just get a little help on the title of this event that this money is going to. Forgive my broken words here, but I believe it's Pueblos de Maize Fiesta. Is that, what is, that's like celebration of corn?
Supervisor, Chair Bronson, Supervisor Christie, roughly, yes.
Okay. Very good. That answers a lot, and I look forward to the information, and I hope
we will follow up. Thank you.
It is a successful county-wide event. Thank you.
Supervisor Scott.
Thank you. Ms. Lesher, the budget for this item says that $153,000 of the $250,000 being awarded is for, quote, contractual professional outside services. And while you're compiling information from Supervisor Christie's inquiries, I'd really like some more detail on that sizable item.
Thank you.
Thank you.
Madam Chair.
Supervisor Christie.
Thank you, Supervisor Scott. That was one thing I did want to point out that I failed to, but he prompted me. If you look in the background, the budget categories and the breakdown of the monies involved, $15,000 for salaries, $163,000 for contractual professional outside services, travel-related expenses of $12,000, other operating expenses of $45,000, and indirect overhead of $25,000. I think that's really what caught my attention on that. But if I could get some clarification on those expenses as well, I'd appreciate it. And I do want it to be a very successful community-wide event.
Certainly, thank you.
Thank you, Supervisor Christie. And speaking of indirect expenses, let's get some clarification about that.
Thank you.
Given my farmer employment, indirect expenses is always an interesting category.
Got it. Thank you.
All right. If there are no further discussion, are there any objections? Hearing none, motion carries.
Excuse me, Chair? Madam Chair?
Yes.
On agenda item number 7, for clarification, the corrected dates were for February 26 and 27.
That's what my notes say. Did I make them?
That's correct, but it also includes April 2nd and April 3rd.
Oh, it's adding more. Got it.
No, they're correcting the February dates, so it's correcting. Originally, we have February 19th and 20th.
February 20th, got it. February 19th and 20th. It's now February 26th and 27th. I erred, so what we approved was February 26th, 27th, and April 2nd, and April 3rd.
Yes, thank you.
All right, thank you. Moving on to item 10, Banner Health, to provide inpatient ordered evaluation services pursuant to ARS Title 36. I'll move the item.
Second.
Motion and a second. Any objections? Hearing none, motion carries. Community and workforce development items 11, 12, and 13. Does anybody wish to divide the question? If not, I'll move those 3 items. Items 11, 12, and 13. There's a motion and a second. Any discussion, any objections? Hearing none, we move on to motion carries. We move on to elections and items 14, precinct line adjustments. I'm going to ask this item be continued till our next meeting. I still have some real issues with it. And our next meeting, I think, is February 15th. Is there a second?
I will second that, Madam Chair.
Okay, Supervisor Christie seconded.
And with that second, I'd like to add to your motion that this item also be sent over to the Elections Integrity Committee for their review prior to that meeting.
I'll still amend my motion. It's a motion and a second on the floor. Any discussion? Any objection? Hearing none, motion carries. Moving on to item 15 and 16. These are master agreements, Peoria Pest Control, and graffiti protective coating. If there's nobody wishes to divide the question, I'll move those 2 items.
Second.
Motion and a second. Any objection? Hearing none, motion carries. Moving on to grant application and acceptance, items 17, 18, 19, and 20, and then moving on to boards, commissions, and committees, item 21. If nobody wishes to divide the question, I'll move those items.
Second.
Motion and a second. Any discussion? Any objection? Hearing none, motion carries. Thank you all for joining us today. That concludes our meeting. We will see you the day after Valentine's Day, February 15th. Everybody stay safe, mask up, social distance, get vaccinated, get boosted, and again, stay safe.
Thank you
for joining us.